My auntie is one of a kind. I trust her with everything, big or small, because I know she always wants what's best for me. She taught me that your health is the only true wealth. Her bigger dream? Making sure everyone can lead a healthy life. Maybe you've met her too. Every day she visits communities where she is the accepted voice, and everyone respects her good sense. She sits down, never judging, just listening, challenging views, removing barriers, creating solutions, and soon enough, the whole village is thriving. No big deal. She's just creating lasting health change. When I think of it, my auntie's pretty amazing. She transforms my community, heals my country, and makes our continent blossom. Did I tell you I have a lot of aunties? They're all AMREF. Wants to be like them? Join us.
It's a decade for action. It's a decade for action. From commitment to action. From commitment to action. It's a decade for action. Iyale mama we. Iyale mama we. Iyale mama we. Iyale mama we. Imberi. Imberi. Iyale mama we. 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 Imberi. Imberi. Iyale mama we. It's a decade for action. It's a decade for action. From commitment to action. From commitment to action. A decade for action. From commitment to action. From commitment to action. It's a decade for action. Iyale mama we. Iyale mama we. Iyale mama we. Iyale mama we. Imberi. Imberi. Iyale mama we. 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 Imberi. Imberi. Iyale mama we.
Welcome to the closing ceremony of the AHAIC 2021. What an amazing 3 days we have spent together. Truly, truly inspiring to listen to so many experts and leading voices on UHC in the time of a pandemic. In fact, I think, and I see some chats also coming through, that we need more time for these conversations. Thank you all so much for being here, for joining us for the last 3 days, and certainly for being here for the closing ceremony. This has been the largest virtual health convening of its kind in Africa, and you were all part of this. The conference brought together almost 3,000 people from 98 countries and from diverse sectors ranging from healthcare practitioners, government, private sector, academia, development partners, civil society, youth, and health advocates. In this closing session, we will do two things. We'll share key highlights from the conference, and we will also recognize and award some very special individuals in an award ceremony. But before we share the key highlights, allow me to acknowledge the members of the organizing committee and our partners.
So you know, Mike and Maria make up.
Okay.
So you know,
Yeah.
I think we have some. We want to acknowledge the members of the organizing committee and our partners who have worked tirelessly to bring this conference together, and without whom none of this would have been possible. We recognize the support accorded by the World Health Organization, both regional and global, and the head of state of Kenya, His Excellency President Uhuru Kenyatta, and of course the ministers of health of Ethiopia, Rwanda, and Kenya, and many more. We acknowledge all of our partners as follows: our co-conveners, the Africa Centers for Disease Control and Prevention, Takeda Pharmaceutical, Roche, Johnson & Johnson, and the International Federation of Pharmaceutical Manufacturers and Associations, IFPMA. Our gold partners, Transform Health and Foundation Botnar, the Primary Care Health Performance Initiative, PHCPI, CREAD, UNFPA, Strategic Purchasing Africa Resource Center, SPARC, PATH, Pathfinder, Malaria No More, UK, and MSD, our silver partners, Philips, General Electric, Governing Health Futures, Nutrition International, our civil society organization partners, Partnership for Maternal, Newborn, and Child Health, and Living Goods, our exhibitor, Echo Carriers, our content partners, Women in Global Health and Women Lift Health, and of course, our media partners who promoted and live streamed the conference, CNBC Africa and SciDevNet. For those of you who registered and participated in the conference as delegates, we do hope we've been able to provide excellent content, thought-provoking discussions, and a few quick announcements before we share with you the key highlights of this conference. The dialogue on UHC will continue. It is not over. It'll continue with our Africa Dialogue webinar series. So do look out for information that we'll be sharing with you starting in April 2021. The launch of the report on the state of UHC in Africa by the AHAIC Commission is available on our website. You can engage directly with the Commission to take some of these recommendations forward and of course collaborate on various aspects of the recommendation. So please do reach out to us via email, ahaic.commission@amref.org. Certificates of attendance for all delegates who have joined us over the last 3 days will be sent to you via email by tomorrow morning, and you will receive a survey. I know we don't like surveys, they take time, but this is really important. If we receive your feedback, it will allow us to serve you better for the next edition of AHAIC, which will be held in March 2023. Mark your calendar. This is an important date, March 2023. It's important because there is going to be a lead up to the UN high-level meeting on UHC. So this is an important date for us and also for you. Now for the key highlights. While the official communique of the conference is going to be available in the coming weeks on both AHAIC and AMREF Health Africa websites, here are our top 8 highlights of AHAIC 2021. These reflect the themes of leadership, accountability, technology, and health security, and all areas that we need to accelerate on. Number 1, we must reaffirm and commit to uphold health as a right of every person, regardless of their socioeconomic status, gender, and age. Number 2, political goodwill must match deliberate action for domestic financing and increased investments in health systems, human resource for health, health infrastructure, health purchasing frameworks, technology, and so on. Number 3, African countries were urged to strengthen emergency preparedness and health security to build back better and mitigate adverse effects of future health emergencies. Number 4, strong support for primary health care as a cornerstone to achieve UHC must be strengthened. Primary health care, as we know it, is the first point of contact for our community's healthcare needs. Number 5, commitment to uphold the right to lead and participate in health development agenda and ensure gender transformative policies and meaningful engagement of Africa's youth for the attainment of UHC. Number 6, UHC needs Pan-African collaboration and collective stakeholder engagement governed by robust frameworks for both public-private partnership and non-traditional partnerships. Number 7, African countries are poised to harness innovation and digital technologies to strengthen access to quality healthcare services while implementing the needed policy and data regulatory frameworks. And number 8, to achieve health and rights for all, people-centered systems and enabling environment for accountability must be in place to ensure that health commitments to communities are achieved and upheld. Thank you once again for joining us and for your contributions to this important dialogue. I would like now to introduce Dr. Githinji Gitahi to preside over the awards ceremony. Dr. Gitahi.
Thank you so much, Desta. Thank you to the more than 3,000 people who've joined us for these 3 days of conversation. We never truly believed that you can host a conference of more than 3,000 people virtually. It has been a challenge, but I must, as the chair of the steering committee for the AHAIC 2021, I would like to congratulate the committee, the steering committee at AMREF and our partner that has actually made this possible. And to all our distinguished guests, some represented here and others who are not here with us, like President Kenyatta, who joined us earlier, we must say thank you. And to our partners, the tens of them who made this possible. I've attended many partner sessions and they were extremely engaging, which also put a challenge on the digital transition from one session to another because people refused to leave, literally, and they just wanted the convention to go on. My role here is to thank all of you. Thank you, Director General Tedros, for joining us today in person. Thank you, Dr. John Kengasong, for joining us here in person. And we are going to spend the next few minutes recognizing health leadership. At the AHAIC 19, which was held face-to-face in Kigali, and I've seen people asking that the next AHAIC 2023 should be face-to-face, we can only make sure that happens by ensuring that we control this pandemic in good time for life to go back to normal and that we avoid the next one that doesn't come so that we can have a face-to-face meeting when we have global health security. Now, in that conference of 2019, AHAIC, or the Africa Health Agenda International Conference, initiated the Africa Health Leadership Awards. The inaugural awardees of this award were His Excellency Paul Kagame, who was awarded the Presidential UHC Leadership Award, and there was the Minister of Health then in Ethiopia, Amir Rahman, who received the Ministerial Award for Primary Healthcare Leadership. This year, AHAIC 2021, we are honored to proceed with this tradition and to honor great people who've shown Africa health leadership and indeed global health leadership. To begin with, I would like to announce the Africa Health Universal Health Coverage Journalism Award. This award is presented to Elizabeth Merab. Elizabeth Merab is a multimedia health and science journalist with the Nation Media Group, which is based in Kenya, but covering largely the East African region. The AHAIC Recognition Awards, as I said, were launched earlier, and today we are awarding somebody who has worked extremely hard. No one could have anticipated how crucial the role of media is, particularly during the COVID-19 pandemic, where access to the accurate information was not only critical, but life-saving. We've had WHO, I think no less than Tedros, call this an infodemic. This year's recipient, Elizabeth Merab, has made significant contributions towards quality health reporting and promoting health issues in the media, and has consistently used her social media platforms to educate her audience about various health topics. This award is open to journalists, photographers, editors, reporters across the continent. And actually, the search for the Global UHC Journalist Award was not an East African affair. It was a continental affair. And Elizabeth Merab emerged the best for this award. Media interventions can potentially play a major role in influencing health policies. These journalists' investigative undertakings on reporting major health issues have led to significant changes in health policies in Kenya. And that is a true example of journalism with an impact. I will own up that recently, Elizabeth Merab sent me a media press release where a politician had requested the media to attend his COVID vaccination event. And we were able, because of our intervention, to actually end that, because we believe, as we have had along, around here, that we must focus on those who are priority first. Her tireless efforts to ensure access to the right information and her consistent call to governments to prioritize health issues is a stellar example of journalism with a positive impact. It is therefore with a sense of great pleasure that we present this year's Africa Health UHC Journalism Award to Elizabeth Merab, Multimedia Health and Science Journalist, Nation Media Group. Ms. Merab, we thank you most sincerely for your efforts and for accepting the recognition on behalf of the AHAIC 2021 Coordinating Committee and AMREF Health Africa, and on my behalf as the chair, and now ask you to make 2-minute acceptance remarks. Over to you, Merab. 2 minutes, please.
Thank you, Dr. Githinji. Good evening. I'm extremely honored to be receiving the Global UHC Journalism Award at a time when global health is so crucial to jumpstarting economies across the world. More importantly, I am honestly grateful for being recognized alongside global health leaders who continue to spearhead the conversation around UHC and the current fight against COVID-19 pandemic. We all know that the role of journalism is to equip the society with the information they need to live their lives. But without journalism, the world would be ignorant. But in this age, we have seen and experienced the power of health journalism in informing and educating people about many a measure put in place to prevent COVID infections, such as wearing of masks, washing of hands, and maintaining physical distance. In many ways, journalists found themselves caught between a rock and a hard place as far as reporting COVID was concerned. For the first time, editors struggled with headlines. Sub-editors were unsure of the photos to use. News presenters fought hard to project composure on set, while reporters and correspondents like me, who are on the front line of events, had to spend endless nights pouring through acres of research and scientific jargon to understand the virus and communicate it in a manner that could influence and even change behaviors. Through health journalism, there has been a deliberate effort to transmit hope, suppress fear, and disseminate accurate information in the era of infodemics. So indeed, the pandemic has shown us how crucial it is to equip journalists with adequate training and contextual knowledge for reporting science and medicine. We are the people who disseminate the policies and directives issued by experts. If experts do not collaborate with journalists, it doesn't matter how good a policy is. If it's not communicated, then it might never elicit the desired change. I sincerely thank you for according me the pleasure to share this platform with global health leaders. I also promise to only get better at my work. Thank you.
So honored to have to give you this award, Merab. As a young woman, and on the week of International Women's Day, we are honored that actually we emerged the winner of this award. Thank you, and we are honored that actually we could get a chance to work with you. The next award for the AHAIC Africa Health Leadership Award was chosen to actually reflect health leadership on COVID-19. So the committee considered and we decided to award the Africa Health Leadership on COVID-19 Award to 2 awardees who have indeed made a major difference to the response of COVID-19 in Africa. So this award is jointly awarded to Dr. John Nkengasong, Director, Africa CDC, and Dr. Matshidiso Moeti, I call her Shidi, Regional Director for Africa World Health Organization. Indeed, the pandemic has been the ultimate test for African leaders in global health. The tireless efforts of our award recipients to ensure health delivery continuity are stellar examples of leadership at its best. It is with great pleasure then that we present this year's Africa Health Leadership on COVID-19 Award to two outstanding leaders, as I've mentioned. I will start off with Dr. John Kengasong. Dr. John Kengasong, a Cameroonian and the first director of Africa CDC, has provided crucial leadership. His leadership in the face of the unprecedented challenge, not only to tackle COVID pandemic, but also the Ebola crisis, has helped ensure continued investment in regional emergency preparedness and response, strengthening of laboratory systems and networks, prioritization of research, surveillance, and disease intelligence with a strong belief on community health systems in disease surveillance and response, and investment to ensure stronger public health information systems. These efforts have not gone unnoticed, John, and we have noticed the trust that you've built in the Africa Union, in the Africa CDC, and the response of private sector to invest in the Africa CDC response with COVID-19 vaccines, testing equipment, PPEs. That is out of the trust of your leadership. Dr. John, I'm honored to present this award to you, and you may now provide your acceptance speech. Over to you, Dr. John. Dr. John, we can't hear you. Ask your people to put on your mic.
Can you hear me now?
We can hear you now. We see you already received your award all the way in Addis Ababa. We are really proud of you. Please
yeah, I'm sharing my very proud award here, really beautiful award. And I'd like to sincerely thank AMREP for the recognizing me. Let me briefly say that I dedicate this award to the tireless staff of the Africa Centers for Disease Control and Prevention, which is your organization. I'm honored to be receiving this award from one of my high-ranking board members, yourself, Dr. Ngitinge, for all what you have been doing in contributing to the development of Africa CDC, which is a young organization. We celebrated our 4th anniversary just a few months ago. Dr. Tedros, I'm honored to have received this award in your presence because the concept, the historians of Africa CDC says that you are the one who walked into one of the head of state summit and made a case for an Africa CDC to be established. And you were also here in Addis Ababa on January 31st, 2017 to do the ribbon cutting of the Africa CDC. So this award is also attributed to you. To my dear sister, Chide Moeti, whom I've had the great fortune of interacting over the last 4 years in a remarkable moment. And we've worked very, very closely over this pandemic. And I'm truly honored and humbled that I'm sharing this award with her. We were on this platform yesterday. We are together again this afternoon, developing a framework between Africa CDC and WHO to coordinate our efforts on the continent. How remarkable it is. But let me just end up by giving my very special appreciation to AMREF that I've known for many, many years. When I was in graduate school, I remember somebody walked to me and said, you know about AMREF? And since then, I started following up. And since then, it symbolized to me 3 things: the spirit of partnership, and the fact that you can truly convene this kind of a meeting, and about 3,000 participants all over the world will gather in there. Speaks to that partnership. AMREP also really symbolized for me the people-centered approach in delivering disease impact and control on our continent. I think you have demonstrated that over and over again. And lastly, your belief in the fact that you have to develop systems and institutions on the continent for sustaining public health action is truly remarkable. So again, I thank you so much, and I look forward to strong partnership between Africa CDC and AMREF going forward.
Thank you very much, Dr. John, and congratulations once again. I see on the comments, everyone agrees on your hard work and your deserving of this award, just as we saw earlier on the comments about Merab. I also want to mention here that I'm very proud that the governing board of Africa CDC found it fit to extend your tenure as the helm of Africa CDC for another 4 years. So we can all on this platform celebrate that John Kengasong is going to continue leading Africa CDC like he has done for the next 4 years, responding to this pandemic and preparing the continent for the next one. And he's in the front lines also discussing the issues around manufacturing and Africa's sustainability of his own responses. And so thank you very much, sir, and thank you. We are honored that you accepted this award. I now want to present to you the next awardee, jointly held between John Kengasong, and the next awardee is Dr. Shidi Moeti. Dr. Moeti's 2 terms as the first woman to serve as the regional director of WHO Afro has shattered the glass ceiling, as we say, paving the way for gender equity in global health leadership, which has been a challenge for long. Even as she paved the way for future leaders in health, she has dealt with unprecedented challenges as a result of the global COVID crisis. Her unwavering leadership and support of governments to take charge and lead the COVID response, and also, I must add, her unwavering frontline support of the Ebola response and the end of wild polio, her undivided attention to strengthening health systems to support logistics and supply chain for vaccines, regional call for investments in innovative approaches, embracing private sector approaches, and collaborating with countries to push for stronger policies and strategic frameworks to address the pandemic has been nothing short of extraordinary. We are really honored to present this award to Dr. Moeti. She will receive it by video because she was engaged in another meeting, and we may now play the video from the acceptance video from Dr. Moeti. Technical team.
Dr. Githinji Gitahi, the AMREF Health Africa Group Chief Executive Officer, my dear friend and colleague of many years, and the AMREF leadership team, dear partners and colleagues. It's my great honor to accept the Africa Health Leadership on COVID-19 Award, and I thank you very much for the recognition, which is really a testament to the tireless work of the entire workforce of the World Health Organization in the African region. The COVID-19 pandemic has affected every African and every person on the planet. With determined leadership of governments and the strong support of partners, together we've stepped up to the greatest challenge in generations. Non-governmental organizations, including philanthropists and business leaders in particular, have mobilized their networks to fill critical gaps in access to supplies and services, among other areas. Building on this experience, at WHO, we will advocate for stronger partnerships across sectors to benefit all areas of health and development. The pandemic has also reaffirmed that engaged communities are at the heart of better health. Enabling individuals is vital so that they can play their roles in surveillance, in outbreak response, in immunization, and in leading healthy lives. So, more needs to be done to address the social and economic determinants of health, including improving access to water and sanitation, to quality education and communications technologies, and to employment and other opportunities. In the past year, we've seen clearly all over the world how inequities are made much worse when disaster strikes. The livelihoods of the most vulnerable people have suffered most. Poverty and food insecurity have increased, and these challenges will have long-term impacts unless collectively there is an all-of-society investment in the recovery from this pandemic and in sustainable development. We know that COVID-19 will not be the last crisis countries face, and it is my hope that this experience has made clear the importance of prioritizing preparedness against future threats by building resilience into our health systems and our societies. I look forward to our continued collaboration in these areas to save lives, to promote health, and to serve the vulnerable. So on behalf of all my colleagues at WHO, thank you very much once again for this award and for your partnership to achieve better health in Africa.
Wow, so inspiring, and thank you so much, Chidi. Even in your absence, the video speaks of who you are. With Africa appreciates your work, working very closely with Africa CDC and other partners, and you found a lot of time to just respond to communities and believing that community is where everything starts. Ladies and gentlemen, it's now my honor to present our last award of the AHAIC Africa Leadership Awards. The AHAIC Africa Leadership Awards are designed to ensure that even global leaders who actually have had a significant impact on the health of African people are recognized. And there's no such other person that we could find than Dr. Tedros Adhanom Ghebreyesus. Dr. Tedros took over as the first African Director General of the World Health Organization, and we have all witnessed that actually Africa remains deep in his heart, that equity has actually been his driving force, and at every point that has been his moral compass. The Global Health Leadership Award recognizes the contributions of a leader who has made significant contributions towards the advancement of universal and equitable health access to health for all, and especially in the African continent. We do recognize that this past year has been one which has demanded an unwavering leadership as we face an unprecedented global health crisis of a magnitude we could not have imagined. Dr. Tedros, I must say, I shake or I tremble to imagine if I was in your position when this pandemic happened. I don't know what I would have done. I probably would have left and come back to Kenya. But with your courage, you continued under extreme pressure from some of your members, extreme pressure from naysayers, extreme pressure now from anti-vaxxers. But we haven't seen you change. We've seen you bring humanity to this response. It is therefore with great pleasure that we present this year's Global Health Leadership Award to you. And under your outstanding leadership, we have seen our nations and regional health bodies make decisive actions aligned to the global call for urgent action. We have seen your courage and steadfast leadership of the World Health Organization during a period of total uncertainty and upheaval across all sectors. We have seen the global call you made for multilateral action, which has actually resulted in the COVAX facility and other many measures. The tough decisions that you've made and the conviction with which you have led despite the challenges. Dr. Tedros, Dr. Martin Luther King said once that the ultimate measure of a man is not where he stands in moments of comfort, but where he stands at times of challenge and controversy. And I can replace man with woman, and I can replace he with she, because this is the world that we want to believe in, that the ultimate measure of everyone is not where they stand in moments of comfort, but where they stand at times of challenge and controversy. Under your leadership, which has been outstanding during this time of challenge, you've guided and supported nations in keeping our populations safe, calling on an end to the possibility of a moral catastrophic moral failure. We thank you most sincerely I now want to invite you to give your acceptance speech, and I would also like to request you to give a few reflections on the conference. Before then, I can request my co-host, Dr. John Kengasong, to do the closing remarks. Over to you, Dr. Tedros.
Thank you. Thank you so much, my brother Gitinji. That's very, very kind of you. I'm really overwhelmed. And you know, what can I say? You know, we have some good moments of reflection also here with colleagues. And one of our colleagues was asked, how are you faring in this unprecedented conditions when you're in the eye of the storm? They asked him. This is one of our colleagues. And he said, you know, we work in good faith and we have faith in each other. That's why even if we're in the middle of the eye of the storm, you know, we do what we do, because what matters at the end of the day is to do things in good faith, and the outcome could be better. So I think I don't think I deserve this as Tedros, but as all of us, you know, together. And thank you so much for this recognition, but I take it as, you know, a collective recognition to all of us. By the way, my colleagues, Mike Ryan, you know him, my general, and also Maria Bankerkov, the trio you see us briefing the world on a regular basis, and they're here with me because they're very, very happy. And Mike was saying, Amref Viva, he like is your fan club. So
yes,
it's
nice meeting you, Mike.
Yeah, it's together. And as John, our brother John Kengasong said earlier, you know, from the inception of the series itself, we have been working together. And that shows again, you know, the working together didn't start now. You know, it dates back. And probably that also helped. And, you know, John is my special envoy also for COVID. And we continue to work together. I think that joint and collective effort really helps us to stay strong and to inspire each other and move on. So I really accept, you know, this award with a mixture of pride and humility, not only on my own behalf, but on behalf of my colleagues here, Mike and Maria. And by the way, in the room, I have Chris, Paul, Carlos, and Alex. And also on behalf of our other colleagues outside this room and beyond, all our health workers, you know, serving in the front lines. So thank you so much indeed. And the second is thank you so much for recognizing John and my colleague Sidi. So John and Sidi, by the way, will have a share from this because we're working together. And thank you for recognizing them. I know the contribution they have made in the past year, and the progress in Africa would not have been possible without our two colleagues, John and Sidi. The response started early, by the way. I remember our meeting on February with all ministers of health, coordinated by African Union and Africa CDC, that culminated in the development of the continental strategy. And then, of course, the political leadership was also very strong, and the bureau that was coordinated by President Ramaphosa, and their every 2 weeks meeting actually to coordinate the efforts of the countries was very, very crucial. It's the hard work they had that resulted into a better outcome in our continent. So well deserved, and thank you for recognizing their efforts. And I would like to congratulate John and Sidi. So if you allow me, I would like to share this with my colleagues who are in the room. Maria and Mike will join me. So we will maybe close together with our masks, so to lift this together. Would you like to make this way so we will be in the photo together?
Fantastic.
Okay. Okay. So you want to hold like this? Yeah, Maria. So.
Fantastic. That is so reassuring. You have such a great team.
Thank you. Thank you so much. Then one thing on the conference, if I would say is, you have shown clearly the centrality of health, and still the main agenda should be universal health coverage, and with a strong foundation, primary health care, and focus on public health so that Africa could be better prepared. So I think this is if I mention anything, that's what I would say. Our countries in the whole continent should really commit to universal health coverage, strong primary health care as its foundation, and build a strong health system to provide better services to citizens, but at the same time better prepare to future pandemics. So thank you so much for your leadership, Githinji. That's how I would summarize actually one central thing, the centrality of health and UHC. So let's work together. All roads should lead to universal health coverage, and look forward to continue working with you, Githinji, and your colleagues, Desta Lakau and others. Thank you so much again.
Thank you so much indeed, and congratulations to Maria and Mike. We always watch you when you're doing your brief, and it's been a critical part of this response, a real northern light to look out to, and we watch them knowing that we'll get guidance that's needed, that is neutral, that countries and can rely on. So thank you so much, Dr. Tedros, for that. And, I don't know whether many of you know that the real agenda of universal health coverage and its lifting at the UN and also at member states has been significantly driven by Dr. Tedros, because out of his being Minister of Health in Ethiopia, he knows the challenges of lack of universal health coverage, especially to those who are most vulnerable. So thank you so much, and we continue to look forward to your continued leadership at WHO. I will now ask my brother and colleague, Dr. John Kengasong, to now make the closing remarks for the conference, and then I'll come back and just tell you exactly, like a master of ceremony, I'll come back and tell you what next. John, over to you for your closing this conference.
Thank you, Githinji, for an excellent conference. And once more, congratulations, Dr. Tedros, and for your award and for your team. I have just 3 points to make to close. I think we heard a remarkable summary from Desta at the close before she introduced you. So I'll not get back to that, but let me rather touch on 3 things. One is that we've all said yesterday and today about the importance of staying faithful to the universal health coverage agenda. I think that is extremely important. Second, it leads us to the need for our continent to take our health security agenda very seriously. We at Africa CDC have actually been calling for a new public health order that will guarantee the health security of our continent, including investing in local or continental manufacturing for diagnostics, vaccines, and therapy. We've heard this from Chairperson Musa Faki Mohammed, the Chairperson of the African Union Commission. We've heard the pronouncement of a new public health order from His Excellency Cyril Ramaphosa when he was chair of the African Union. The third point I want to make is that, I really enjoyed the theme of this conference, which was building back better. But I'll add that we should build back better, but be bolder and bigger for the continent so that we can address both our universal health coverage and our health security needs without being courageous, taking the courage, without being bolder, without thinking big. I think we would have missed this crisis. As the saying goes, you never waste a crisis. It is my hope that we will win this pandemic, the fight against this pandemic, we overcome it, but we need to ride on its back to build back better, bolder, and bigger. Lastly, is that our Agenda 2063, the Africa we want, will be guided and underpinned by our ability to implement universal health coverage and our health security agenda. A healthy people is a wealthy people. And we've just launched the free trade agreement for a continent of 1.2 billion people. And in the coming days, I'll be meeting with the Secretary of the Free Trade Agreement, Wankele, to discuss how public health can be aligned to support the continent to achieve the goals of the Continental Free Trade Agreement. And none of that will be doable without proper investment in our health security, proper investment in universal health coverage. We are a continent of 1.2 billion, projected to be 2.4 billion in the next 30 years. So that says in the next 30 years, 1 in 4 people or 5 in the world will be African. And unless and until we strengthen our universal health coverage reach, invest in our health security, our aspiration to be the continent of the future will be challenged. So let me thank you so much for this opportunity to partner with you in organizing this extremely impactful and successful conference. I thank you.
Thank you so much for those closing remarks. And for me is to say health is wealth. And if Africa is going to contribute more than the 2% of the global GDP it currently contributes, we have to invest in the people's health. The 17% of the population of the one that resides in Africa must be healthy for Africa to build this GDP. This is it. There's no other thing, because healthy adults earn and healthy children learn. It is the most fundamental human right. And this conference is all about that. I must thank all the global health leaders, the African health leaders who are making this possible. I am now going to invite you to a closing performance of a few minutes video. And after that, just to let you know that the platform is going to be open for networking, to visit partner booths. So don't leave from the conference, go on and network, get to know each other, ask as many questions as possible, because 3 days is not enough to achieve all the things we want to achieve. So please proceed to the platform and participate. And with those few remarks, the conference is now closed. Welcome to the networking sessions and welcome to the closing performance. Over to the technical team, and thank you all.
It's a decade for action. Say that again. It's a decade for action. From commitment to action. From commitment to action. It's a decade for action. It's a new action. It's a new action. The language mental action. The language mental action. We're singing for health, affordable health, quality health care. Yeah, singing From commitment to action. Universal health coverage. It did not be good. It did not be good. Himberi. It's a decade for action. It's a decade for action. From commitment to action. Sing it louder. From commitment to action. Let's come together. It's a decade for action. It's a decade for action. The language mental action. The language mental action. It's a single action. Iyale mama we. Iyale mama we. Iyale mama we. Iyale mama we. Himberi. Iyale mama we. 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 Himberi. Iyale mama we. It's a single action. It's a single action. The language mental action. The language mental action. It's a single action.
From commitment to action.
Ateno totally down ya dem. Tatali na toka misuri mani mambe. Tatali mama toto nya tito jabe. Tatali na toka misuri mani dem. Totally down. Ateno totally down ya dem. Tatali na toka misuri mani dem. Tatali mama toto nya tito jabe. Tatali na toka misuri mani dem. Totally down. Ateno totally down ya dem. Totally down. Toka misuri mani mambe. Tatali mama toto nya tito jabe. Totally down. Toka misuri mani dem. Totally down.
Skiza story sasa.
Ilikuwa mwaka wa 94. Na tena katoka zaliwa huko nyumbani. Nyumbani kizaliwa totally down tena. Tena lida zaliwa totally down. Totally down. Malida kamwimbia nyimbo. Kitabu hilo kazana shule muhimu wa teno. Mengine yatafuata ukienda huko shuleni. Na ya mwalimu kufuata atena totally down. Totally down. Safaulu na maisha. Wanuna wazazi wako. Umilia ulaisha pesa. Atena totally down. Wakati na ulifika. Atena totally down. Wafanya wakavu. Wakati na ulifika. Totally down. Kumbuka tena konde. Siyaga Ogorunda. Kumbuka leti nyasingo. Sinoga hallelujah. Ogorunda. Weka mchezo kando tunasonga nyuma. Rusha mkono kando karoka na uma. Tukiwa juu chini sipoteze muda. Totally down. If you want to spend your money, go to Mombasa. Atakapoiza salari tembea Mombasa. Nyimbo zake zote Suzana huyo zilizopenda. Atena totally down ya be. Totally down. Toka Kisumu nyumbani mambe. Toto ya mama toto si toto nya tito jabe. Totally down. Toka Kisumu nyumbani nyade. Totally down. Giwachoni pesa. Wanasema pesa utas. Hongo anashika. Wanakata kama makas. Hongi wanalia. Wanafura kama mandas. Ketola sope pesa. Pia na mziki ni kas. You go Atendo totally. You go Atendo totally. You go Atendo totally. You go totally. You go Atendo totally. You go somamandas Kisolo sope Pepesa Piana mzikini kas
Thank you, everyone. Be safe. Thank you, Dr. Tedros, for staying on. We appreciate the work of WHO. Thank you very much, all.
Thank you, Gitinji. Congratulations for your leadership. Thank you so much. Thank you.
Thank you very much. Thank you.
Yeah.
And bye for now.
Bye.